And good morning to you. It is October 1st, 2024. Tamika Chambers here with another question as an NCLEX tutor, coach. Which of the following is an adverse effect to therapeutic radiation therapy? All right, so as you know, I encourage you to have something to write with, something to write on, and write down your rationale because you are looking to see, am I thinking more like a nurse? That's what the NCLEX is looking for. Are you able to properly apply the knowledge that you have learned? All right, so we're looking at adverse effects to therapeutic radiation. Which one of the following conditions is one? All right, so we're trying to find the other piece to the puzzle of adverse effect therapeutic radiation therapy. Is it A, fibrosis, B, alopecia, C, oral dryness, or D, xerostomia? All right, so go ahead and write your answer and then go ahead and return to this question. All right, so if we're looking at B, C, and D, those are actually side effects because you're typically, when you have radiation therapy, and you also think about, with other types of therapy, but radiation specifically messes with the cells of your hair, your stomach, etc. And so what we're looking at here is, what is this word? Xerostomia. So we look at it and we break it down. Zero means dry, stomia means pertaining to the mouth, right? So we're looking at some dryness still of the mouth, and that is still a side effect. So A is actually an adverse effect, right? That is not something that typically is noted to happen with therapeutic radiation therapy. And then when we look at the answer, there you go. So it's an adverse effect. Fibrosis can affect different parts of the body. Alopecia, oral dryness, also is xerostomia, is a side effect and not a complication or adverse reaction. One of the things that I do typically try to do is, as I pull up this slide here, is that with pharm, it's so important for you to know the difference between therapeutic effect, side effect, idiosyncratic, which is the weird. These are most common. Cumulative is like it, both medications can cause it. When you think about your blood pressure medications and both how beta blockers and ACE inhibitors can decrease blood pressure. Adverse effects are typically those that really can happen, but they're not expected, if you will. So it's so important to make sure that you are familiar with those types, because remember, your response is going to be different depending on the type of effect that they have. If it's therapeutic, right? If it's a side effect, we're going to talk to them and say, this is a known effect, versus something that is not, we're going to definitely notify that doctor, follow the protocol. So as I always tell you, more than you think you know. All right, you guys, so it's so important to make sure you can break down those words when you're doing questions. And even if you don't think you know, tell yourself, I know more than I think I know, and I can do this. Be looking for the NCLEX mindset, especially if you're wanting to bypass a lot of problems, issues that many nursing graduates have. It's not just content, not just questions, but there are other things involved, structure and how you're answering these questions that I address in the NCLEX 6X Mindset mini course, coming to you soon, just wrapping up some things here. And for repeat test takers as well as initial test takers. You got this, guys. You know more than you think you know, and sometimes you just need a little tweaking, right? Just to address some issues that are going on before you go on and do the great work that you are here to do as a nurse. Talk to you soon. Take care of yourself.